problem. Thank you very much. And thank you for Depane and his very, very informative presentation as well. So my name is Mina Kinghorn. I'm a non-Indigenous woman who works as a research translation impact manager with the Let's Yarn About Sleep team. And today I'll be presenting on developing visual tools for participant information and consent in sleep health research on behalf of my fellow co-authors as well. So firstly, I would just like to acknowledge the traditional owners and their custodianships on the lands on which we meet. For me, it's the Turrbal and Yagara people today. And I'd also like to acknowledge the lands on which you all call from today as well as the Kalkatungu people of Kalkadoon country in Mount Isa, where this program is largely situated. So we pay our respects to their ancestors, their descendants, and who continue cultural and spiritual connections to country. We recognise their valuable contributions to Australian and global society. So a little bit about the Let's Yarn About Sleep program. So it's a sleep health equity program aiming to improve sleep for and with First Nations peoples. So sleep contributes really significantly to our health, including physical, mental, social, and emotional realms. And early findings of this program found that for the First Nations peoples we were working with, this was a large part of cultural connection. So within sleeping, that was the time when you're able to connect to ancestors, the dreaming, hear messages, and have inspiration for your creative endeavors. Sleep is often overlooked, but it's really important that sleep is addressed as a pillar towards a healthy and full life. So some of the bits and pieces our program focuses on are co-designing sleep health programs with schools and communities to improve the health of young people, training the health workforce in delivering culturally responsive sleep healthcare, embedding sleep healthcare within existing health service models, and improving the diagnosis and management pathways of sleep-related disorders and the implementation and evaluations of these programs. So we work with community members, young people, schools, clinicians, youth and social workers, respiratory specialists, psychologists, hospitals, pretty much anyone who is health related, young people related. And as you can see, we work in predominantly rural and remote areas. So sleep resources and services are usually limited in these areas. And so our program of work attempts to make this more equitable and accessible. And a little bit about who we are. So our guiding values and the framework we adhere to are based on principles of truth, reciprocity, integrity, innovation, reflexivity, trust, partnership, and respect. And the way we uphold those values and make sure they're embedded in everything that we do from the beginning of the research process to the end of it is our governance model. So this is comprised of 4 different groups. So our community steering group is comprised of representatives from our LIAS program communities. They come together to guide us in all aspects of our work and as well as helping shape our future directions. And then we have our data governance group. So our First Nations data governance group is made up of Aboriginal and Torres Strait Islander researchers. They bring a unique perspective of both culture and identity while also understanding the Academy very intimately. Due to this, their guidance and insight is one of the pillars of our program. They have final say on all of our data-related activities and outputs. And then we also have the Knowledge Mobilization Group and Service Providers Uptake Groups. These are strategy groups that ensure that with all the time and energy our participants give us, that we're making the most of the data we're collecting and addressing challenges and barriers in the best way possible. So a little bit about visual consent and how the story started with our group. So the Let's Yarn About Sleep project was a really, really tiny project that was awarded a small grant to understand the sleep health needs of the community in Mount Isa. It quickly became apparent that people were not interested at all in engaging with consent forms. They essentially flicked through and signed. It was generally through a face-to-face explanation of the forms where they got all of the information that they needed. And service providers would sometimes read the first page, but ultimately just flick through the rest as well. And so what our community researchers found is that the consent process was more so based in the trust developed between the participant and the researcher built over time. And consent forms became sort of a tick box at the end. And another thing that flagged this for them was they would go through the research process, so conduct workshops. And then at the end, that's when participants would ask consent-related questions. So with all of this information, it was brought to our community steering group. And essentially their feedback for us was that researchers are coming into community and bringing way too much paperwork. So informed consent in research is crucial for meeting ethical standards, transparency, voluntary participation. However, the current process relies on text-heavy documents filled with complex academic language, making it really difficult for participants to understand and engage with the research thoroughly. This can lead to misunderstanding and disengagement, posing a significant challenge to obtaining genuine informed consent. So from our observations, it seemed like consent was very good at protecting the institution, but was not so good at empowering the participant from the beginning of the research process. And so how we aim to address that was, you can see up here, we have our community steering group, some of our community researchers and our community lead. We also have Dr. Ray Cooper, a Warramie woman, and Ray Ison down the bottom here as well. So following a collaborative process, we drew on the feedback from the community researchers and partnered with Ray and Hannah, visual communication experts, to create interactive information and consent maps. So the initial discussions with the community researchers and the visual communication experts focused on identifying the key concepts and planning the sequence and presentation of the information in a way that was consumer-centric and accessible while maintaining the rigor of informed consent processes. Ray and Hannah then developed these visual consent tools using graphic design and interacting prototype techniques, and the community researchers provided invaluable feedback along the journey of that to really assess the clarity and usability of these tools. Finally, the Let's Learn About Sleep First Nations Data Governance Group assessed these tools, focusing on whether they were effective, culturally responsive, and suitable for sleep health research with First Nations communities. So the final stage involved obtaining institutional ethical approval and then ultimately to test and evaluate these tools. So a little look into what we produced. So these are the forms for the community consent and information. So ultimately, the group created these extremely beautiful visual consent information maps. These resources focused on telling the story of our project. So you can see on the right-hand side, we have this beautiful piece of art by Arnie Judith Rose telling the story of sleep and essentially what was going on for this family pictured above. The elements were taken from this beautiful piece of work and used as a visual motif throughout the document. And so you can see that we provide an outline of how we like to conduct our research, but also addressing topics like what will I be asked to do, possible benefits from taking part, possible risks and disadvantages of taking part, what will happen to information about me, what happens if I decide to withdraw. So you can see all the text has been significantly reduced and written in plain English, getting rid of any academic language that has the potential to disengage participants. And so the service provider maps follow a similar layout and language as well. And as you can see just on the right-hand side here, this style is a flipbook format. So participants are able to interact with a physical document rather than just glazing over it. So it's essentially, it pulls out into about a meter long document and it folds up. So you're physically present with the document while you're reading it. And you'll also notice just up here that there are QR codes. So if participants would rather a traditional form, text-heavy documents, they're able to scan and have a digital copy of that as well. And then for our young people, we knew it was important that we took a different approach, but also embedded the story style format, which our community steering group was very passionate about. So working with our sleep coaches, and they work primarily with students and young people, we were able to create a comic book style consent form that showed them some of the technology they might be using, such as an actigraphy watch down here. So I know I wouldn't really know what an actigraphy watch was unless I saw a photo of it. So it's little notes like this that provide additional information that written language alone would likely be unable to supply. So part of the process and how we use these maps are that the researchers give the consent and information sheets over to the participants, and then a consent interview takes place where the researcher will go through the document with the participant, and any questions that they have will be answered conversationally. And if participants prefer, they can ask for a physical copy of the participant information and consent sheets. So again, the traditional kind of format of it. So these are accessible, or if they prefer the digital copies, they can scan the QR forms. And so we're yet to conduct the evaluation, but how we'll be doing this is a visual participation information sheet and consent map survey. So this will evaluate preference, engagement, and acceptability compared to a standard consent process. So we're aiming to have this evaluation conducted in September to October 2025. So the bulk of our data collection will start in the first half of the year. So far, we've used the visual consent map with community members and service providers. We haven't had any formal feedback as of yet, but what our researchers are reporting that people are taking longer with the document, and rather than just like flipping through it, it's a very intentional page by page process, which is great to see. But we'll find out more, I guess, in September next year. And so what we've learnt so far was the University of Queensland's Ethics Board was actually extremely supportive of this. We hypothesized that this could be demonstrating of a shift towards alternative forms of consent, but it could also be because we did supply the traditional alternatives through the QR code and physical copy as well. We think that there's a shift towards how researchers are seeing consent, rather than having the focus on legalities and protections, having that certainly as a side, but also holding the participant throughout the whole consent journey as well. And excitingly, I think we're seeing the acceptability of visual tools. It might be too early to say that, but hopefully once we conduct our evaluation, this is, yeah, a part of the literature we can add to. But yeah, that's all. Thank you so much. And if you guys have any additional questions, feel free to reach out to us.
Thank you. Thank you very much. Now, I'm just looking in the chat. I can't see at the moment any particular questions, although I have a couple myself, if I may, Mina. I might have missed it. I beg your pardon if I did. How young is the cohort you're trying to involve in this?
For our young people?
Yes.
Yeah,
Yes.
so we're looking at adolescents. So we're looking around 12 to 16.
Yes. Okay. Okay. And when I was curious, certainly this project looking at the visual consent, clearly there's been a group already established which has recognised the problem of sleep inequity. So how did that original project get off the ground? So was it something that was recognised within the community, by service providers, by others? How did that develop?
Yeah, definitely. So this program began with our research lead, so Dr. Fatima. Essentially, she was awarded an extremely small grant, I think it was $10,000, to go out to community and talk about sleep. And sleep, even in urban populations, is something that's very, very under, I guess, researched. And so in talking to community, it was essentially going to be focused on obstructive sleep apnea, but talking to elders, talking to the community members, it became very apparent that while sleep disorders was certainly something that needed to be addressed, it was young people that was the main focus. It was using technology in bed. It was going to bed really, really late at night and then coming to school being completely disengaged because you don't have the energy to start. And so from talking to all of the service providers and all different community members, that's when they were able to put this information together and develop a sleep health education program.
Okay, thank you. We've got a question in the chat. How do the consent resources negotiate or consider different communities? Is it broad enough to encompass localized differences in languages and meanings?
Yeah, definitely. So this was big conversation at the beginning of starting this visual consent process. Language can become very contentious, and so can different symbols, like totems, those sorts of things as well. So it was very important for us that we created a very generalized document. So focusing on kind of, you could see color palettes that were drawn from pieces of art that were very meaningful for the people that we worked with, as well as making references to more natural toned colors that could reflect a little bit of country as well. Focusing more on organic shapes. And so it was using visual cues that weren't necessarily representative of like a toad, something very, very specific. It was drawing on things that you would see out on country more than anything else.
Okay. Great, thank you. Do you also have video-based consent examples? Is that accessible through perhaps the QR codes, or you haven't moved to video yet?
No, we haven't, but I'm really excited for that. We've started a couple visual animation projects as a part of adding to our curriculum for First Nations young people. But I really hope that in the future that we can maybe see this consent process turning into a short video.
Okay, great. And finally, I had another question. I'll just check that there. Right. Okay. Sorry, I was just checking that. How is consent noted? So I presume, do you ask for written consent? Do you ask for verbal consent? Do you just say, you know, you're happy to continue? Is consent sort of implied by involvement, or what?
Yeah, no, so there's definitely verbal and written consent processes. So this is more of a format if they choose to engage with it that they can choose to. So we do definitely still cover traditional kind of consent as well. And just making it very, very clear that at any point, if they wish to not continue, that's okay. That's so possible. And I think really where this hinges for our program is our community researchers having trust within the communities that they work with. So I would say this has been, I guess, a little bit more acceptable in the ways that we've done it. I know because it hinges on our community researchers and the deep relationships they have with the community.
Thank you very much indeed, Mina. And you've had